Did you know that a 71-year-old man passed away in his sleep last night? His loved ones were shocked. Just the day before, he had seemed perfectly healthy, with no apparent serious ailments. That evening was completely ordinary, no different from any other, yet he never woke up the next morning. What caused this tragedy? And could it have been prevented? The truth is, after reaching 70, certain routine actions before bed can subtly expose the body to significant risk, substantially increasing the likelihood of serious complications like strokes, heart attacks, and even sudden death. Most alarmingly, the vast majority of people don't even realize they regularly make these potentially dangerous mistakes. This article will detail 4 nighttime habits strongly recommended for individuals over 70 to avoid. These actions, seemingly minor and harmless, can nonetheless have a profound and long-term impact on overall health and longevity. Some might surprise readers, while others may have been practiced for years without any awareness of their consequences. By the end of this article, readers will gain the comprehensive knowledge needed to effectively protect their bodies, significantly improve sleep quality, and wake up daily feeling energized and well. It's important to read to the end, as the last habit mentioned is something most older adults unconsciously practice every night, thereby putting themselves at serious risk. We will also explain in detail what alternative actions can be taken to ensure a safer and healthier night's rest. Habit number 1. Late and heavy dinners. One of the most widespread yet extremely dangerous pre-sleep habits for people over 70 is consuming heavy and large meals shortly before going to bed. Many might perceive this as a completely harmless action, perhaps having practiced it for years without any visible negative consequences. However, with time, as we age, the human body begins to process food in a completely different way. What a person eats before bed, and even more critically, the timing of that meal, can significantly impact the quality of nighttime rest, the state of the cardiovascular system, and even the likelihood of sudden and serious complications occurring during the night. Consider this. In your younger years, you likely could enjoy a hearty dinner late in the evening and still experience deep, peaceful sleep. However, now that you're over 70, your body's metabolic processes have slowed considerably, your digestive system functions less efficiently, and consequently, your body requires much more time to fully break down and absorb food. Such changes can trigger a range of undesirable conditions, including acid reflux, severe sleep disturbances, and even a persistent increase in blood pressure. All these interconnected factors, in turn, are associated with a substantially higher risk of critical conditions like heart attacks and strokes, especially during nighttime rest. If you've ever woken up in the middle of the night experiencing heartburn, general discomfort, or a racing heart, it's highly probable that your late dinner habits were the cause. Here's what happens in your body when you consume a large meal right before going to sleep. Instead of focusing on achieving deep, restorative sleep, your body is forced to actively engage in the digestion process. Your stomach starts producing acid vigorously, your intestines work overtime, and your heart rate remains elevated, whereas normally it should slow down for proper rest. This triggers a chain reaction within the body, keeping it in a lighter, restless sleep state and significantly increasing the likelihood of sudden cardiovascular events. As a vivid example, imagine a situation where you enjoy a late dinner, perhaps a heavy pasta dish or a greasy burger, just before heading to bed. You might feel full and satisfied, but when your body assumes a horizontal position, it becomes extremely difficult for your body to keep stomach acid contained within the stomach where it belongs. As a result, this acid can travel up the esophagus, causing unpleasant discomfort, coughing fits, or even a choking sensation that inevitably interrupts sleep. Over time, chronic acid reflux, widely known as GERD, can weaken the muscles of the throat and airways, significantly increasing the risk of aspiration pneumonia, a severe lung infection that poses a serious threat to older adults and can be fatal. Furthermore, an excessively late dinner can trigger sharp spikes in blood sugar levels. If you have diabetes or are at an increased risk of developing it, this habit can cause a serious glucose imbalance, making it significantly harder for your body to regulate blood sugar levels during nighttime sleep. Numerous studies convincingly demonstrate that older adults who regularly eat late in the evening have a significantly higher chance of developing various metabolic disorders, which, in turn, actively contribute to the onset and progression of heart disease. The natural question arises, what should be done instead? You should aim to finish your last meal at least 3 to 4 hours before your intended bedtime. This time interval will provide your body with sufficient time to properly digest food before you lie down. If you feel the need for a light snack before bed, prioritize easily digestible foods that won't overly burden your digestive system, such as a handful of nuts, a small piece of fruit, or a cup of warm herbal tea. These options will not only do no harm, but, on the contrary, can contribute to better and deeper sleep without causing discomfort. It's important to remember that as you age, your body functions differently than it did decades ago. By making such a simple yet significant adjustment to your daily eating schedule, you can substantially reduce the risk of nighttime health problems, noticeably improve your sleep quality, and ensure your body gets the complete rest it truly needs. Habit number 2, excessive fluid intake before bed. Many people are convinced that maintaining optimal hydration is always an unconditional good. And while this statement is generally true, consuming an excessive amount of fluids, especially in the evening hours before sleep, can become detrimental to health with age. If you're over 70 and regularly wake up several times a night with an urgent need to use the restroom, it might be time to reconsider your evening fluid intake. However, sleep disruption is not the only problem this habit can cause. It can also significantly increase the risk of falls, provoke cardiovascular problems, and even contribute to the development of cognitive impairment over time. The reason for this importance is as follows. As the body ages, the bladder naturally loses its efficiency in holding urine for extended periods. The muscles responsible for its function weaken, kidneys continue to actively filter fluids even at night, and the body becomes significantly more sensitive to even a small volume of fluid present in the system. This means that if you drink a large glass of water, tea, or juice directly before bed, the likelihood of waking up at night with an urgent need to go to the bathroom significantly increases. And while this might seem like just a minor inconvenience, the potential consequences can be far more serious than they appear at first glance. Imagine the situation. It's the middle of the night, and you suddenly wake up with a full bladder. You try to get out of bed quickly, but your blood pressure doesn't have time to adapt to the change in body position. This can lead to a condition known as postural hypotension, a sudden drop in blood pressure upon standing up, which in turn can cause dizziness, lightheadedness, and even fainting. Many older adults experience this phenomenon without realizing its nature, and unfortunately, it is one of the most common causes of dangerous nighttime falls. A simple trip to the bathroom can turn into a serious, life-threatening accident, leading to fractures, head injuries, or even more tragic outcomes. In addition to the risk of falls, frequent nighttime urination, medically known as nocturia, can seriously disrupt a person's natural sleep cycle. Every time you wake up and turn on the light, your brain mistakenly perceives this as the arrival of morning. This disrupts the natural production of melatonin, a hormone that plays a key role in ensuring deep and restorative sleep. Over time, chronically poor sleep quality can lead to a weakened immune system, increased blood pressure, and even accelerate cognitive decline. Studies have convincingly shown that older adults who frequently wake up at night have a higher risk of developing dementia and other memory problems, which is directly linked to prolonged sleep disruption. However, the importance of body hydration remains undeniable. So, what is the best solution in this situation? Instead of completely giving up fluid intake, try adjusting your intake schedule. It is recommended to consume most of your necessary fluids in the first half of the day, gradually reducing your intake towards the evening. If you feel thirsty in the evening, take small sips, avoiding drinking a full glass at once. And if you consume caffeinated beverages like coffee or tea in the afternoon, remember that caffeine acts as a diuretic, increasing urine production and thereby exacerbating the problem of nighttime awakenings. Another helpful tip: pay attention to hidden sources of fluid in your daily diet. Soups, high-water fruits, and even some medications can contribute to fluid retention in the body and increase the likelihood of nighttime awakenings. By making these small but targeted adjustments, you can significantly improve your sleep quality, substantially reduce the risk of nighttime falls, and maintain your overall health in the long term. Habit number 3, too warm a bedroom. A cozy and warm bedroom might seem very appealing and comfortable, but if you're over 70, too high a room temperature at night can subtly put your health at serious risk. Many older adults mistakenly set their thermostat to the maximum or bundle up in heavy blankets, believing it will help them sleep better. But the truth is, sleeping in an excessively warm room can significantly increase the risk of cardiovascular problems, cause dehydration, and lead to extremely poor sleep quality, even if you don't realize it. As we age, our bodies become less efficient at regulating their own temperature. The ability to sweat and effectively release excess heat decreases, making it easier for body temperature to rise, especially during nighttime rest. When a person's body overheats, the heart has to work twice as hard to cool down, which can create undue and unnecessary strain on the entire cardiovascular system. This circumstance becomes especially dangerous for older adults suffering from heart conditions, high blood pressure, or circulation problems. Think about it. Have you ever woken up in the middle of the night in a sweat, feeling restless, or even slightly suffocated? This is a clear sign that your body is desperately trying to regulate its temperature. Studies convincingly show that sleeping in a warm room significantly increases the risk of dehydration, even if you don't feel overtly thirsty. Mild dehydration at night can lead to blood thickening, which in turn increases the risk of blood clots, heart attacks, and strokes, especially in older adults. Consider a specific example. Imagine Frank, a 74-year-old retiree who loves to read in bed before sleep. He keeps his bedroom temperature at a comfortable 24 degrees Celsius, 75 degrees Fahrenheit, and bundles up in thick blankets to feel warm. However, night after night, he tosses and turns, wakes up drenched in sweat, and feels completely exhausted the next morning. Frank doesn't realize that his warm sleep environment disrupts his body's natural sleep cycle, preventing him from reaching the deep, restorative stages of sleep that are absolutely essential for maintaining optimal health. A cooler room, on the contrary, promotes significantly better sleep by prompting the body to naturally lower its core temperature. This process is critically important for achieving deep sleep, which, in turn, aids memory consolidation, normal immune system function, and overall longevity. Older adults who consistently sleep in a cooler environment report waking up feeling more rested, energetic, and clear-headed. So, what is the ideal temperature for sleep? Sleep experts recommend maintaining a bedroom temperature in the range of 15 to 19 degrees Celsius, 59 to 66 degrees Fahrenheit, for optimal sleep quality. If this temperature range feels too cold, you could try using several layers of breathable cotton blankets instead of heavy synthetic ones, which tend to trap heat. Wearing light, moisture-wicking sleepwear can also effectively help regulate body temperature throughout the night. Another simple but effective trick is to open a window for fresh air or use a small fan for air circulation. This not only helps cool the room, but also improves air quality, reducing the risk of respiratory problems that could disrupt sleep. Making this seemingly small adjustment to your sleep environment can have a powerful and positive impact on your overall health. By keeping your bedroom cool, you significantly reduce the risk of cardiovascular strain, promote deeper and better quality sleep, and wake up more rested, avoiding the dangers associated with overheating. Now, let's discuss the last pre-sleep habit, which is especially risky for older adults, but many unconsciously practice it every night. This might surprise you greatly. Habit number 4, wrong sleeping position. Most people don't pay much attention to how they sleep, assuming that as long as they're comfortable, everything is fine. However, after 70, the position in which a person sleeps can have a much more significant impact on their health than they realize. An incorrect sleeping position can lead to serious breathing problems, impaired circulation, and even increase the risk of developing heart failure or stroke. Nevertheless, Many older adults unconsciously sleep in ways that put unnecessary and excessive strain on their bodies every night. The reason for this importance is as follows. With age, the human body naturally undergoes changes in muscle tone, lung function, and circulation. Being in an incorrect position for several hours straight can lead to restricted airflow, reduced oxygen levels, and pressure on key blood vessels, making it significantly harder for the body to function properly during sleep. Over time, this can contribute to a range of problems, from common snoring and sleep apnea to more serious conditions like nocturnal heart strain. For example, sleeping on your back might seem like a comfortable and natural choice, but for many older adults, it is actually one of the riskiest positions. When a person lies on their back, gravity causes their tongue and soft tissues in the throat to relax and fall backward, partially blocking the airways. This can lead to obstructive sleep apnea, a condition where breathing repeatedly stops and restarts during sleep. Many people don't even realize they have this condition, but it can significantly increase the risk of heart disease, high blood pressure, and even sudden cardiac arrest. Consider Robert, a 76-year-old man who always slept on his back. His wife noticed that sometimes he would stop breathing for several seconds at night before gasping for air. At first, he dismissed these observations, believing they were just normal signs of aging. But over time, he started waking up feeling completely exhausted, suffering from headaches, and problems concentrating during the day. When he finally saw his doctor, he learned that his usual sleeping position was contributing to undiagnosed sleep apnea, putting excessive strain on his heart every night. Even without diagnosed sleep apnea, an incorrect sleeping position can significantly impact circulation. Studies show that sleeping on your right side puts additional pressure on the heart, making it much harder for blood to circulate efficiently throughout the body. This circumstance becomes especially relevant for older adults with heart conditions, as it can contribute to fluid accumulation in the lungs and lower extremities, leading over time to a condition known as congestive heart failure. So, what is considered the best sleeping position after 70? Experts strongly recommend sleeping on your left side, if possible. This position promotes improved circulation, allows the heart to pump blood more efficiently, and even favorably affects digestion in people prone to acid reflux or heartburn. Sleeping on your left side can prevent stomach acid from entering the throat, thereby reducing discomfort and significantly improving sleep quality. If you find it difficult to stay on your side during sleep, you can try using a body pillow to prevent inadvertently rolling onto your back. Slightly elevating your head with a supportive pillow can also help keep airways open and reduce the risk of breathing disturbances. And if you experience joint pain or stiffness, placing a pillow between your knees can help maintain proper spinal alignment and reduce pressure on your lower back. Making this seemingly simple adjustment to your usual sleeping position can have a profound and positive impact on your overall health. By ensuring an optimal body position for circulation, breathing, and heart function, you can significantly reduce the risk of nighttime health complications and wake up more rested and energetic. Concluding thoughts. We have thoroughly examined 4 pre-sleep habits that, at first glance, might seem completely harmless, but can actually put a person's health at serious risk after reaching 70. From eating dinner too late to excessive fluid intake before bed, from a room that's too warm to an incorrect sleeping position. Each of these habits can subtly but consistently affect heart function, sleep quality, and overall well-being. The good news is that these risks are not immutable or fatal. By making small but thoughtful adjustments to your nightly routine, you can significantly improve your sleep, reduce the risk of developing serious health problems, and wake up each morning feeling stronger and more refreshed. Now, take a moment to reflect. Which of these habits do you recognize in your own routine? Do you often wake up in the middle of the night? Have you ever felt restless or overheated while sleeping? Perhaps you've been sleeping on your back for years, completely unaware of the potential negative consequences. In any case, the key to success is awareness. Once a person is aware of the problem, they can take targeted steps to effectively address it. So, here's my suggestion for you today. Pay close attention to your bedtime routine. Try changing just one of these habits, and carefully observe how it impacts your sleep and overall well-being. Perhaps you'll shift your last meal a bit earlier, lower the thermostat in your bedroom, or consciously turn onto your left side while sleeping. Even one small change, consistently applied over time, can lead to a significant improvement in your quality of life.